What testing is appropriate, when is it enough? And when I teach medical students, I tell them that the most important test that you can order for a patient is to talk to them. The history. The history is by far the most important information. You can go for an echocardiogram to look at how the heart is pumping. You can get a stress test, either a nuclear stress test or a stress echocardiogram, to look to see if there's decreased flow going to the heart muscle. But at the end of the day, what your patient tells you is what you're going to listen to. So if somebody comes to me and I think that they may have angina, a blockage in an artery, the first test I might order is a stress test. And I'd probably order a nuclear stress test where you get on a treadmill, you exercise, and they take a picture of the heart at rest and exercise, and they label the blood cells to see if there's decreased flow going to the muscle. That implies a blockage. Now that test is not 100% accurate. And you may have symptoms that to me sound like angina, and the stress test comes out 100% normal. But you say, Rich, I'm telling you, every time I walk, I get tightness in my chest. I stop, it goes away. I used to be able to play tennis. After the first set now, I can't breathe. And I say, gee, well, your stress test was normal, Harvey. You know, I mean, stress tests don't lie, it's a test. And you say, I don't care what the stress test shows, I don't feel good. Well, you listen to the patient, and the stress test is not 100% accurate. You go to the next test, which is an angiogram, and then you look at the actual artery. So to answer your question, testing really relates to the patient's symptoms. If a patient's not that symptomatic, and you prove to your satisfaction that they're not in a life-threatening situation, you don't necessarily need to run $1 billion worth of tests.